Welcome to the Diary of a Medicinal Chemist.
About metabolism, and we have said that the liver is the primary site for metabolism, and a number of about transformations occur in the liver. For instance, we have the phase one biotransformation, which essentially involves having your drug undergoing a number of changes. Could be oxidation, could be hydroxylation, and so on. Also, we can have a phase two metabolism, which is the addition of a more soluble adduct. That is it could be the sulfate or the glucuronide to your compound to make it more soluble so that it can be excreted from the body. Now, there are a number of factors that affect the transformation of drugs. The first one we'll look at is the race. Of course, race in a way plays an important role in biotransformations of drugs, in that it is possible that there is a differential biotransformation in terms of the rate of biotransformation of a particular drug in two populations. For instance, you have the Africans, you have the Caucasians, you have the Asians, you have the Americans. Now we have a number of isozymes of CYP450 enzymes that we did discuss before. Their percentage expression, the percentage expression of a number of them differs from population to population. So, for instance, if you have a particular drug that is metabolized by a particular isozyme of CYP450 enzyme, and if it is used by Africans, let's say for instance, Africans genetically they have a higher expression of that particular enzyme. That means the metabolism of that drug will be faster in Africans compared to Americans, for instance, if they have a lower expression of that particular isozyme. Also, another factor that can affect that transformation is age. We've said the first one we have race, also age. The age of the patient can also affect biotransformation. For instance, for the younger folks, for the babies, when you look at the kind of drugs, even for infants, you see that most times we avoid giving them solids, giving them drugs that are already in the solid form, because at that point or at that level, their metabolic machinery is not fully developed. So there are a number of drugs that can be administered solely to children or infants, so to speak. So as they begin to grow, the metabolic machinery also grows, also becomes more developed. So there is a correlation between the age and, of course, the biotransformation of drugs. And also, when one gets elderly, the liver, there is reduced function of the liver. And again, we have to be cautious of the kind of drugs we administer, because the liver is not as active as it used to be before getting that old. So again, a lot of cautions are exercised in administering drugs to various populations of ages. Now, aside that, we can also have gender, or rather the sex. Of course, it's possible to have disparity in terms of our transformation between the male and the female. There are some drugs that are solely for female. There are some drugs that are solely administered to male. There are some drugs that are administered to both the females and males. And even in the ones that are administered to both gender, we see that there are a number of drugs that there is a disparity in terms of the how fast metabolism occur. There are some particular drugs that in the male folks, males will be able to metabolize it faster than the female folks. So in other words, for the male, that means you need more dosage. So if you're administering, let's say, 20 milligram to the female, hypothetically, you may be administering 25 milligram of that same drug to the males, because males are faster metabolizers of that particular drug.